I love the question of what does good treatment for an eating disorder look like? And how do you know if you're getting it? Eating disorders, from binge eating disorder to bulimia nervosa to anorexia nervosa to avoidant restrictive food intake disorder, to everything in between, whatever diagnostic class we're talking about, these are disorders where there is some sort of behavioral disturbance. So if your treatment is not helping you to make behavioral change, if you are not seeing a change in your symptoms, whether, that symptom improvement is eating less restrictively or improving your pattern of eating or reducing your purging or over exercise or reducing your binge eating frequency, right? If it's not, affecting change, affecting improvement that is measurable to you in those ways, then it's not hitting the target that it needs to hit to help you recover. So the strongest evidence base for treatment for eating disorders are behaviorally focused treatments. So these include family-based treatment for adolescents with eating disorders, individual cognitive behavioral therapy for bulimia nervosa and binge eating disorder. And behaviorally based treatments will spend a lot of time really talking about normalizing eating, normalizing weight for people who need to improve their weight to a physically healthy spot. But I would just say, even if you're not in a behaviorally oriented treatment, right, a thing to pay attention to know whether or not it's helping you is whether it is affecting change and symptom improvement in really measurable ways. And if it's not, then for those who are not in a behaviorally oriented treatment, you probably want to make a shift in that direction. For those who are in a behaviorally oriented treatment, you probably want to dial up the intensity. And that can look different for different people. But that's how you know that treatment's helping with these disorders. The piece around understanding how it came to be, really making significant strides in body satisfaction, those are elements of recovery that tend to be staged out a little bit later. And some of the eating and related behavioral disturbances just have to be addressed first in order to do that other work.